First at 5 tonight, we're asking parents, will they buy in? After Pfizer announced this week its vaccine is safe for children 5 to 11 years old. The company says in low doses, early data shows the vaccine is effective, making it a potential game changer for millions of families. Thanks for joining us. I'm Corey Stark.
And I'm Lauren Traeger in for Samantha today. News 4's Caroline Hecker spoke with some parents who enrolled their children in the trial. Caroline is joining us live at Pfizer in Chesterfield.
Well, guys, this specific Pfizer trial for those 5 to 11-year-olds gained way more interest, organizers tell me, than there were actually spots available. So they ended up turning a lot of people away. The same goes for the Moderna vaccine trial that took place through Washington University. But today I spoke with some parents who enrolled their kids in both. They tell me their kids were eager to take part and they weren't forced to do anything. A green light from the FDA later this month could mean more than 28 million children ages 5 to 11 are eligible for the COVID vaccine. Part of the data collected by Pfizer coming from children taking part in the trial here in St. Louis.
Definitely thought it was safe for them to get. We didn't really think about that at all. And the flip side is COVID is so much more scary. And particularly now with kids, it's a pretty brainless decision.
Clinical research professionals in Chesterfield has enrolled 110 children in this Pfizer study since June. The director says they received hundreds of interested parents, but had limited spots. Overall, she says children have tolerated the vaccine very well. Buckhold's twin 10-year-old daughters got their first shot about a month ago and received their second dose last week.
They have to journal their symptoms every day. So like if, the day after their arm was sore, they have to kind of journal that out, report that. They check their temperature every night, report that.
After their second dose, he says his daughters felt achy for a day and then were fine. They don't know yet if they received the vaccine or a placebo, but Buckhold says his daughters were willing participants and eager to take part.
It's not just dying, it's being in the hospital, it's being sick enough that their growth and development might be blunted.
Ashley Hayden's 8 and 10-year-old boys are enrolled in the Moderna COVID vaccine trial through Washington University's School of Medicine. While Moderna hasn't released much data on the effectiveness in young children, Hayden says the benefits outweigh the risks.
At this point in the COVID era, we were just mostly eager to help prove the safety of the vaccine so that other people will be encouraged to get it once it's available.
Now, when it comes to this age group, Pfizer plans to file with the FDA for that emergency use authorization by the end of this month. But national polling will tell you that parents' openness to the vaccination decreases with the child's age. We're live in Chesterfield tonight. Caroline Hecker, News 4.